Hi guys, I'm going to go ahead and I guess make this little quick video, a couple little videos just to talk about the cardiac stuff that I didn't get time to in class. What I'm not going to do is go over the basic anatomy from this slide about the blood flow through the heart and the valves. You should already know this. This is pathophysiology after all. And if you're not familiar with it, again, go back to your anatomy books and look up on it a little bit and see where you're at. I'm going to be talking obviously about the valves here. So again, just quick reminder, right atrium, right ventricle, the tricuspid valve over there, might mention it here or there. The left ventricle is mainly what we're typically talking about, coming from left atrium to left ventricle and then out the aorta to the rest of the body. It's about all I'm really saying about that. What I do want to talk about a little bit is about the valve defects. For example, stenosis. The word stenosis means that the valve doesn't open fully, but it also means that there's a narrowing, okay? So you can actually define it either way. It's still the same thing, that either your valve is narrowed or it doesn't open fully. It means the same thing. What I kind of wanted to say about that is that when we're talking about stenosis, I'm going to go ahead and see if this works, and say this is, your okay, so this is the heart, right? And you got a little valve right here going from the left atrium into the left ventricle here, which of course is going to go out the aorta to the rest of the body. But if we had a stenotic valve, so if we're looking at this valve, and that was the normal size of it, and you have a stenotic valve, then that valve, maybe it's more narrowed or something like that. And one of the ways that that can happen is when we have some kind of infection that affects that valve. So for example, maybe we get, a nasty kind of strep infection, that the strep goes throughout the body and ends up getting in a fight with the immune complexes right there at the valve. And as you can see, if it does that, it can narrow the valve. It can cause it to be stenotic. It can cause it so it doesn't quite do what it's supposed to do. And clearly that's going to cause some problems when you're trying to push blood through one valve, from one chamber through a valve to another one. And we will see that. If you look over here, we'll see right there where you have rheumatic fever and rheumatic heart disease, okay? I need to let you know they're pretty much the same thing. So when you're talking about, well, they are the same thing. When you're talking about causes of valvular defects, whether that is the stenosis where it doesn't open all the way, or whether we're talking about the regurg or insufficiency or prolapse of a valve, which means it's going back the wrong way. When you have things like that, one of the things that you might want to just think about, hey, I wonder if this is connected to it, is a strep infection. So I know people have had a lot of experience with strep infections. It's very common. People get strep throat, and that's typically where people kind of stop thinking about it. Well, the problem with strep is that it certainly doesn't all the time, but it can get so bad and get such a bacterial load of especially that group A beta hemolytic strep, it goes into the bloodstream and it travels around, and then it meets in kind of almost fairly predictable places where it meets the immune system, and then they have that big war, and of course create these vegetations that I was talking about on the valves. So it could make it so it doesn't open fully, or stenotic, meaning it doesn't open fully, or it's narrowed, okay? Or of course it can do the regurgitation, the insufficiency, the prolapse. But the reason it has rheumatic fever and rheumatic heart disease is because strep is known to cause a fever, of course. Other than the tonsil issue, it can also cause a fever, and sometimes they will call that fever rheumatic fever, and sometimes they'll call it scarlet fever. Both words, rheumatic and scarlet, mean red. So somebody gets really flushed, they get a really high fever usually, but it's also they get really flushed and that sort of thing, and then the immune complexes again can go to these different valves and they can cause problems, okay? So if you're talking about rheumatic fever right here, that's what we're talking about, is a strep infection kind of gone bad that may have actually caused some mitral valve stenosis. Talking about rheumatic heart disease, you're really talking about the same thing. You're just talking about when the strep went and and cause something in your heart. Typically, we are talking about valves, but I wouldn't. I guess the point of this is don't get too stressed about whether it's mitral or aortic valve stenosis, whether you link it with rheumatic fever or rheumatic heart disease. It's the same thing, okay? In either case, it's one of those group A beta hemolytic streptococcus things, and that can cause the vegetations or the destruction of the valve. Okay. As you can see, the tricuspid valve can also be involved with anything, actually. Any valve can be stenotic or regurgitant. So I wanted to point out again, rheumatic fever, rheumatic heart disease, or sometimes called infective endocarditis because, of course, strep is an infection. And endocarditis is just talking about the inside layer of the heart, or the inside muscular layer technically, but again, any place in the heart muscle, whether it's a valve or whether it's other parts of the heart muscle, you would still call it infective endocarditis. So it's really the same thing. Okay, what kind of stands out on the slide a little bit is probably these connective tissue diseases right here. Now, connective tissue diseases are they're what they say they are. They're diseases of the connective tissue. So I don't know if any of you guys have ever, seen like Cirque du Soleil or something like that, where, you can take a real life person and they can fold themselves up and stick them in a little box, right? Very, very, very stretchy. Well, stretchy cartilage is cool. And, if you had your finger and you can take it and like bend it all the way back to your wrist, that's great at parties. On the other hand, think about that ability to have that kind of stretchy connective tissue, whether it's, too elastic, elastin, or collagen is too elastic, or whatever it is. It's, like I said, kind of cool at parties, but not really great if you are putting that in your heart, right? In your heart valve. So, heart valves, they're supposed to, blood goes down and then they open up and let the blood through. And then when the blood gets through and the other ventricle, for example, contracts, it's going to slap those valves together. Well, if you can imagine what a problem that's going to be if it's stretchy and all of a sudden, the left ventricle contracts and stretch, wink, back up, blood goes back up, and now you have more blood left in your left atrium than you are supposed to have, which of course is going to cause a high pressure in the left atrium, which is going to back up into the lungs, and this is where we get some of these signs and symptoms back here, like cough or dyspnea, right? Because now you have fluid that is blood, of course, but again, you get too much blood, it's going to throw off our hydrostatic osmotic pressures in the lungs, and you start seeping it out, and now you have edema inside your lungs, which can cause you to cough. It can cause you to have dyspnea or shortness of breath. It can certainly produce some pink frothy sputum, where people are literally just kind of coughing up the fluid that is coming from the blood that's seeping into the lungs from, again, having too high a pressure in there, because you can't get the blood out of the left atrium because it keeps coming back, which means that the left ventricle is going to not be able to kick as much blood out to the systemic circulation as it should. And certainly we have a cascade of negative effects from that. Now, one thing that you should probably be familiar with, of course, is how do we apply that with the physiology that we know. What's going to happen to that left ventricle when it has its end diastolic volume? Is that going to make any kind of a impact on there? Is it going to make a difference on stroke volume? Is it going to make a difference on blood pressure? Is it going to make a difference on et cetera, pulmonary congestion and all that sort of thing? So kind of keep that in mind, kind of work through it. And if you need to draw it out, draw it out. But what we really care about is not just learning the physiology, we care about applying the physiology, okay? Again, heart murmur, if you didn't know that, is just the sound. Normally when valves close, we hear that. It's, lup, dub, lup, dub, lup, dub. Well, heart murmur is just, again, if that regurgitant valve or that prolapse valve kicks back the other way, you hear the lup, swoosh. Yeah, I can't do both sounds at the same time, but hopefully you know what I mean, okay? So like I said before, what we're really talking about is rheumatic fever. And if you look at this, this gross slide of what the group A beta hemolytic strep did when it met up with the exaggerated immune response at that valve. It tore it up. Okay, so we will call those vegetations when you have that kind of destruction of a valve. We say that the bacteria and the antibodies just basically had a war there and left this, again, organic shrapnel or vegetations all over the heart. And you can see where that could be a problem if that valve needs to seal, if it needs to open fully or close fully for that matter. Okay? So, kind of already talked about rheumatic fever and the fact that it can cause, carditis. Infective endocarditis was also what it was called. So, again, hopefully you get the idea. It's called many different things, but it's all the same thing. Now, what is a little bit bizarre on this, and when you start looking at any kind of disease or condition, look for things that are bizarre, right? The signs and symptoms of carditis, that totally makes sense because of that, right? Not really a big deal. On the other hand, polyarthritis, we're talking about rheumatic fever, and now somebody has polyarthritis or arthritis in many different places. Okay. Maybe they're coming in for that. Maybe they're coming in for arthritis and you realize that they also have carditis. Or maybe they're coming in for carditis and then you realize after getting a good history that they also have arthritis in many different places in their body. Okay, it certainly could happen, but try to keep it in mind because you don't want to get too stuck on one symptom and realize that, oh my goodness, we're having this clinical scenario here that is going to point to something like rheumatic fever and the effects of that. Okay, chorea is very interesting. Go ahead and look that one up on YouTube, and you'll see where it's not just like I have on here, jerky muscle twitches. It's much more than that. It's flailing almost. They call it Saint Vitus dance sometimes when. It's like the arms and neck and back and spine and everything is just kind of flailing and I don't know. I think like biblical stuff. Nailing and was it? I definitely messed that up. The wailing and gnashing of teeth kind of thing, where it looks horrible when you see it. Anyway, look it up if you got a few minutes. The reason it's saying here is also mistaken for ringworm is because what we're talking about here is this little rash right here that is called Erythema marginatum. Okay, what that rash is doing is literally saying what it is. Erythema means redness, and redness around the margins or the outside is where they get that name, Erythema marginatum. So again, this is a very particular looking rash that can be in conjunction with this carditis, heart valve murmurs, heart valve stenosis, prolapse with polyarthritis, the jerking muscle twitches, and this rash. That should paint a pretty clear clinical picture that I can't really think of anything else that does all of that sort of thing. So again, what you're looking for in your patient is, you start racking all those things up. Make the connection. That's one of the tricks, right, of the whole pathophysiology is making the connections and figuring out what it is. And then you can go ahead and, go down here and you can, do your strep test and, your anti-streptolysin O titers, which are things that will give you a pretty, we give you definitive yes, in fact, he does have a strep infection or did have a strep infection very recently and causes all of this problem. Okay. So let me break right there because I want to talk about pericarditis for a second. And this is already up to 14 minutes.